what were some of the initiatives that you've launched over the past couple of years that have created change for the practices?
We did software conversion. We needed to get up to speed with what's best in industry.
We had to change the HRIS system. We had to change the way we communicate with the practices. We ripped out all 3 of our PMS systems from ortho to ASC to pedo. We changed the telephony. You name it, we changed it.
If you can lead with why and what the impact will be for the individual, the buy-in comes quickly after. It's been relatively seamless.
Welcome back to the Dental Economist Show. I'm your host, Mike Huffaker. Before we dive into today's conversation, just a friendly reminder, if you're enjoying the show, please make sure to like, subscribe, or even better yet, leave a review wherever you consume your podcasts. It would be greatly appreciated, and your support helps us continue to bring valuable insights to dental professionals everywhere. Today, we are joined by 2 leaders who live at the intersection of strategy and execution at Chord Specialty Dental Partners. First, CEO Todd Cruse. Todd's career spans healthcare delivery, dental services, and public policy, giving him a really unique lens on growth, access, and long-term sustainability. Also with us is COO Alayna Brent. Alayna has scaled operations inside rapidly growing dental organizations and is known for building systems that drive consistency while protecting patient experience and team culture. Together, Todd and Alayna bring a powerful CEO-COO perspective on scalability, standardization, and leadership, and what it truly takes to grow a specialty DSO without breaking that which matters most. Todd and Alayna, welcome to the show. It's great to have you both here.
Thanks, Mike.
Thanks. We're glad to be here.
Yeah, so I was looking through LinkedIn. It looks like, Todd, you came on board as CEO about 2.5 years ago. And Alayna, you joined just a little over 2 years. Is that accurate?
That is correct.
That's right.
And neither of you are any stranger to dental, both having had extensive experience in the industry. And Alayna, I know that you had worked with some very large DSOs like D4C previously. But what was it like entering the new organization with having executive leadership change kind of at the top at the same time? And how did you kind of navigate that to help the organization understand where things were going and also to help everyone get to a level of comfort with the changes that took place?
Right.
Yeah.
I think what helped us make it seamless, because big change of that nature can sometimes be challenging, as Todd mentioned. But one thing that both Todd and myself value very highly is boots on the ground. So I think we did a 3-month road show of visiting all locations and talking to providers and team members and understanding the business at the core level. And I think that built some instantaneous rapport and really helped us integrate pretty quickly.
Yeah, no, that's an incredible approach. I recently had on the CEO of 123 Dentist in Canada, and he was sharing something similar, that he had just finished his 100th clinic visit over the first 4 or 5 months of his time there in the role. But I've had a conversation with other folks where they almost seem to dive directly into the spreadsheets and start staring at the numbers in the absence of having those conversations. I'd be curious, Alayna, from that experience and building that credibility with the team, was there anything that was surprising to you, or that you learned in those visits that was really kind of formative in the approach that you had taken after that?
Yeah, I think having been in dental for so many years, taking the approach of visiting practices, really understanding from the ground level what was happening, it really helped to kind of tie in to the spreadsheets that we were also diving into. We call it often reason and remedy. And so we were able to get to that place and find the reason that certain things might be showing up from a financial or an analytic standpoint, and then quickly create the remedy. Probably most surprising to me was the siloed approach that we inherited. And, there were practices that were a mile and a half down the street, but providers didn't know one another, team members didn't know one another. And I think that's been the huge impact that's been made at the location level. Now we know who our partners are, and it could be something as simple as sending over a hygienist or a dental assistant or a provider picking up a day in an office they aren't typically in. But that cohesion has really, really helped to unify the teams overall.
I agree with that, actually. I think it was funny, Mike. I visited all the practices in the first 6 months. I think it's a good thing to do. But day 9, I asked 10 docs to dinner from the different brands and the different locations. And they had only 2 of them knew each other. Everybody else they just didn't know each other. And about halfway through dinner, I just sat back and they were sharing best practices and talking about situations and scenarios. I'm like, we got to do more of this in order to get to the right outcomes.
Yeah, I think it's one of the interesting things with DSOs is you can have kind of a support organization culture, but then there's the culture within the practices. And it sounds like what you all had inherited, there was a massive disconnect between the two. And even within individual practices, there wasn't the feeling of belonging that would be so powerful to have as being part of a larger organization. How do you think about culture in general and about extending the culture from the executive leadership of Chord all the way out through the practices themselves?
Yeah, good question. So we have a couple of core tenets to culture, and then I've got a personal philosophy. So I've been doing this long enough that personal philosophy is, you take care of your team members and you take care of your patients, economics will always follow. Yeah. Hard and fast, right? And so if we lead with that mentality, everything seems to fall into place. But transparency is important. We are overly transparent in this organization with everybody, whether it's the doctors that own the practices or the staff member that's sitting chairside. And we also drive a big portion of collaboration. We expect the left and the right hand to always be working together. And then most importantly, we try to encourage people to have fun. Because if you're not having fun and enjoying what you're doing, you're not going to be in it for the long haul, and you may not be doing it for the right reasons.
Yeah, absolutely.
I always tell this story when I sat down with Todd. He had been within Chord for a couple of months, was doing his road show, and I sat down to interview, and that was one of the questions that I asked him was, what is your philosophy on how you'll run this business? And he shared exactly that. And I have it written down in a notebook from 13 years ago: people first, dollars follow. And that alignment was really important to me, and being able to live that out with open book management and really that transparency it's been huge. And I think that really lends to the positive culture that we see here today.
Yeah, I think transparency is super important. It can also create the need to have hard conversations, because if you're being transparent, there's often going to be initiatives or changes that need to take place that folks are not, at least at first glance, super bought into, because there's always this perpetual resistance to change that I think is just kind of inherent. When a new leadership team comes in, there's always going to be change. Maybe Alayna, if you wouldn't mind sharing, what were some of the initiatives that you've kind of launched over the past couple of years that have created change for the practices? Maybe how did you approach them, and what was the manner within which you were able to get buy-in for those changes?
How much time do we have, Mike?
We got a while. Go for it.
No, there's been a ton of change. Major initiatives that come to mind. We did software conversion. We needed to get kind of up to speed with what's best in industry. So that was one big change. Another more tactical practice level change was offering same-day treatment to patients. That's something that historically hadn't been done, but we know is best for the patient when time and staffing allows. And another big change is we've really elevated our operations level team at the practice level with some of that open book management that I mentioned before. And the approach always with any initiative that we do is explaining the why first. And what I've found in my time in any DSO, but especially within Chord, is if you can lead with why and what the impact will be for the individual and the betterment of their day to day, then the buy-in comes pretty quickly after. And that's been the approach we've taken with those few initiatives, but dozens more that have been implemented, and it's been relatively seamless. We've got great team members, so we couldn't really ask for more in that regard.
That's great. And you've overcome some large challenges with software conversions and implementations is one of the largest, I think, friction points that you can create with a new change that's implemented into practices. So to be able to navigate through that is a real testament to the approach that you all are taking. Todd, I'd be curious, you mentioned the personal philosophy before about focusing on the people and the dollars will follow. I know that there's still challenges that occur within a practice or an organization where it is more difficult to get somebody to buy in, or perhaps you have an underperforming practice. How do you approach those conversations? What's been kind of your strategy for kind of engaging in a way that is still meeting people where they are with an understanding of where their concerns are, but with also knowing that it's going to be integral to the business to move forward in a different way?
Yeah, I mean, Mike, I think everything has to be grounded in fact and data, right? At the end of the day, you show trends, you compare people to their peers, you talk about what's happening in the industry, but you're not sticking your thumb up or your finger up in the wind and say, hey, I feel this way. It's like, I know this because this is what the data shows, right? And we can do better by our patients by doing X, or we can do better by our team by doing Y. And, whether that's patient satisfaction, whether that's the number of patients that make it through the day, whether it's wait times, whatever it may be, if you are grounding it in fact, there's really little wiggle room around the conversation. It may not be, to your point, a comfortable conversation sometimes, but it's not like this is not an emotional discussion. You have to be almost dispassionate to a point and say, this is what the numbers are showing, or this is what the data is showing.
Now, you've mentioned quite a few new initiatives and different changes that have taken place. What type of communication cadence do you have with your practices? How do they stay in the know, and how do you prevent a disconnect from happening?
Well, Alayna and her team do a great job, right? So we have regional directors that are in the practices all the time. We send out weekly announcements. We use a intranet so that people can get on and get the information anytime they want to. And this was all, as Alayna said, part of the change, right? When we came in, we had to change the HRIS system. We had to change the way we communicate with the practices. We ripped out all three of our PMS systems, from ortho to ASC to pedo. We changed the telephony. I mean, you name it, we changed it, and all in the vein of trying to make communication easier, because that's important, right? You have to communicate frequently in order for people to understand, right? And as Alayna said, if you don't lead with the why every time you communicate, whether that's a town hall, which we do frequently, or again, in the email blast that we send out, or in the intranet, the follow-up question is always the whiffle question, right? The what's in it for me question. And so you need to answer that first, and then get on to like, hey, this is why, this is why we're doing it. This is why it's going to yield results. This is why it's going to be good for your patients. This is why it's going to be good for your community. Because you also have to think that we're in a ton of different types of communities. Yeah. And you want to make sure that what the decisions or the ideas that we're sharing amongst the various practices work for the communities that the practices are in.
Yeah, it sounds like you've put in place a really, really strong foundation at this point. As you're kind of looking forward, what are some of the things in 2026 that you're most excited about?
Automation, leveraging AI in the space, specifically around call volumes. I think there's a huge opportunity as AI has improved for telephony services. I think that's something that we're really looking forward to. There's also a lot of, I call them widget functions because I don't have a better name for it, but there's a lot of widget functions that can be automated to make the experience better for the employees, whether that's onboarding, offboarding, expense management, ordering of supplies, whatever. in today's day and age, there's no reason why you can't be leaning heavily into automation.
Yeah. What about you, Alayna?
Yeah, I'd say I'd echo Todd for sure. I think the automation piece is huge, and a couple of things that I'm excited about in 2026. I think growth, obviously, and that's the cliche thing to say. But as we've done acquisitions in 2025, we have a really good strategy team that put together an incredible playbook and transition process. So our integration playbook is 60 days. If a practice is merged within Chord, then within 60 days, all the things that we've talked about are implemented and actionable. And that's been, it was a huge success in 2025. So I look forward to refining that process even further in 2026. So that would be one big area that I'm excited for this year.
I agree.
Yeah. No, it's great to have that operational rigor in place. It's surprising how many folks I talk to where there aren't SOPs kind of available, where the integration path for new practices almost looks different every single time. It's not necessarily a kind of, hey, this is what we know to work, and this is how it's going to, be integrated into our organization. When you're thinking about growth and thinking about acquisitions, well, first off, do you do any de novos, or is the strategy pure acquisition at this point?
Right now, it's pure acquisition. I think, and again, we've talked about this at the beginning. We've been in this for a while. The early 2000s was all about de novo growth, right? Everybody was in the practice everywhere. I think now it's a time to go through what I consider the second or even the third phase in the industry of consolidation. So it'll be almost entirely M&A. Now, if we can't buy it, we'll build it, but I would much rather acquire something. I think in the whole DSO industry, in general, there's just too much SG&A in the industry. There's got to be consolidation that occurs to sort of right size the industry to where it needs to be.
On that note, too, I think one way that we've implemented the framework of a de novo, but within the existing business, is looking at our current service lines being specialty only. But we've gone into a number of our locations, and either, if it's a pediatric dental location, we've added orthodontics to create that, consistency and ease of transition for our patients. The same is true for oral surgery. And we have ambulatory surgery centers too. So not a de novo four-wall from, the ground up, but we've implemented that approach within the existing business, which has worked incredibly well for our patients. They can essentially get every area of care that they need in dentistry under one umbrella. And with our communication across practices that we touched on earlier, that makes it really a much better patient experience from what we found.
I agree.
I love that.
That if you can't get care from us, you just can't get it. We have the complete flywheel, especially on the special side. And so as we think about growth, back to the growth question, I think it's important that we stick to our lane too, right? Like we are pure play. We're probably one of the only pure play specialty DSOs. We have hardly any GPs. So we're very focused on sticking to our lane and thinking through how do we build this flywheel in every market that we're in.
Yeah. No, I as a patient appreciate that experience. I don't have it personally, but I remember the first time, actually the only time I had to have one root canal in my life, and I went into the dentist that day and found out that that's what I was going to need to have, and I left with a piece of paper in my hand and instructions to go how to go pursue and schedule and make my appointment to have that taken place. And it was like the last thing in the world I wanted to do. And I was already like disappointed and angry that I needed to have a root canal. And then I had to go do the extra work to follow up to actually have it done. And just the whole experience was like, this is really unpleasant. There's got to be a much better way to take care of the patient and not just like send them out the door when they're all confused still and going like, I don't want to do this.
I agree with that.
Yeah. As a parent, I think it's so important that if someone can take the mental load from you, that it matters. And so if we start treating adults for root canals, we'll give you a call, Mike, make sure you're taken care of. That comes up.
Perfect. Thank you. What are some of the challenges or obstacles in adding new service lines? Are you having specialists that travel between different practices? Are there logistical concerns that are brought up that have to be navigated in order to effectively kind of implement that model? How do you think about it? And for anybody else that might be out there going like, yeah, we could probably add some specialty lines to our current business today. What are some of the things that they should be thinking of?
Yeah. I mean, recruiting is always a challenge when we talk about like some of the headwinds in 26 is the workforce. And it's been that way since 2019. So, having a rotating specialist that can fill the gaps when needed is like, in my opinion, that's how you start. And then eventually you're going to recruit and fill, because one of the things we learned when we got here is, one of the downfalls to prior management was they would move doctors around all the time. They would ask these doctors to go everywhere and they get burned out, right? They want a home. They want to build a team. They want to be anchored into a place. And so making sure that, we keep that in mind. When you're starting to add a specialty line, it's great if you have a specialist that'll cover 2 or 3 or even 4 locations. But eventually you need to have a mind's eye towards anchoring people in one location and making that cohesive team, because if a team's not cohesive, it's not going to function well.
And from a clinical standpoint, I think back to my roots in dentistry, if you are practicing with a different provider each day of the week, it's really hard to create efficient workflow and patient flow within your practices. To Todd's point, yes, you can start that way, but when we even bring on that initial provider that may be going to a few locations, we're already recruiting, already looking ahead to find the next provider, because we've, our pro formas are tight and we typically perform to them. So we kind of know when that next lever will need to be pulled, and we start with that. So it's.
Yeah, it kind of goes back to taking care of your team and taking care of your patients, right? Your patients also want to see the same person when they come in again and again, and they get to know them and they build that sort of oral health home. That's it. That's a key component to success as well.
Yeah. Touching on the recruiting piece, because you're certainly not alone with those challenges. Do you have any tips or approaches that have been particularly effective to help overcome some of the challenges in recruiting new doctors these days?
On the doctor side, it's just getting out there and making relationships with them, right? The new grads, especially in the specialty space, they want to go someplace where they can continue learning, to be honest, or where they can continue to, perfect their craft, as I've heard many of them say. And so building that relationship and explaining to them what you have to offer in some of the locations that you manage is very important. And, doctor recruiting has actually not been so bad. I'd tell you the headwind has been the auxiliary staff. And I know they don't care for that term, but, the price of hygienists and dental assistants, hygienists specifically, they've gone up 60% in the last 3 years. And that's a challenge.
Yeah.
One way we've overcome that is, with the open book management approach, we also know that while Todd, myself, the other members of our executive team can provide the vision and visibility into the overall performance and business health, they're the ones that are really doing the work. And so we've been able to create incentive at the practice level, around access to care for patients. So with the same day treatment initiative, with adding days, when we do add a specialty to a certain location, we really try to put that back into the practices. And still a headwind for sure. I think it always will be. But we're really trying to make sure that the people that are making a difference are incentivized to do so.
And Alayna, can you speak a little bit more about the open book management approach, what that means to you, how you define it, and how it shows up in the day-to-day?
Yeah, I can. I remember the first time I ever saw P&L, and I was maybe a year or two into dentistry and had no idea what it meant and why it mattered to me. And so as I've gone through my career, I've kept that at the forefront. And I think for Chord, what that means is that we really elevated our operations managers and kind of brought them into the circle to say, hey, this is the health of the practice that you're responsible for, but here's the health of the business overall. And of course, we're not going into, every single accounting practice,
Sure.
but we keep high level what is important to them and what they can impact. And we do that through monthly sessions where we feature one of our departments at the home support office each month based on what they have questions around. And we definitely dig into financials. And when we came in, that's not something that they had ever even heard of or seen. And now to see the growth of the operations team overall in the last 2 years has been really, really incredible. And open book management for me is just being transparent about the health of the business and allowing the people that are in the four walls to impact change and give ideas and suggestions and then share those with their peers.
Yeah, I love that. We do something very similar here at Planet DDS. And I think even the fact that you're creating some of that financial fluency for your team and the organization, that's equipping them for career progression as well and giving opportunities for growth. Because you're right, a lot of us look at our first P&L or income statement or something else. It's like, what this is, it looks foreign to me. I don't understand what's important about this, what I should be looking at, what I should be drawing from it. Every month we do a company all hands, and we actually share pretty in-depth financials of our organization to our team, which a lot of folks are like, I've never been to a company that does this, but we think it's important to have that level of transparency so everyone's aware of, hey, sometimes there's challenges, of course, but then we can all be aligned on where improvements need to be made, and the why becomes easier to understand when you're able to translate that.
Yeah.
Going back to the acquisition approach and M&A, what are a few of the green flags for you all when you're in initial conversations with somebody looking to sell their practice? And what are some of the maybe non-starters or red flags that they come up, and when you see them, your spidey sense goes off and you're like, this is not going to be the right fit for Chord?
Yeah, no, good question. So I think the green flags for us, it really comes back to the doctor, right? Do they want to continue doing this work? Are they happy, being part of a larger organization? 9 times out of 10, most of them were like, please, I don't want to deal with payroll. I don't want to deal with any of this. I just want to be wet finger doctor. So that's usually pretty good. But some folks still want to maintain that tight control. And that's very difficult for Alayna and her team to manage the overall P&L, right? I mean, part of the value of a DSO is bringing in, volume-based pricing on a formulary for supplies. And so sometimes you have to make changes. If they're not willing to make the changes, we may take a step back and say, you're not ready for this. So that's one of them. I think patient satisfaction is another one for us, right? We show up, it's got high patient satisfaction. That's great. We know that there's a good team and a caring team on site. I also look at, this is kind of weird, but I look at deferred maintenance of the practice. If somebody doesn't take care of their practice, it's an overall sort of leading indicator of how they feel about the environment around them. And so that's one of that may make me step back. The number one red flag for me is we do chart audits. I mean, as part of any M&A activity, we want to audit the quality of the care that's delivered.
Yeah.
If those come back and they're not great, that's a huge red flag for us, because you end up, having to clean up a mess that was not of your doing, and it just doesn't make a lot of sense. So I think, compliance is probably the number one thing in my basket that I'm always concerned about. Are you doing the appropriate care? Are you doing the right kind of charting? Are you making sure your notes are clean so you don't have insurance payer problems or board problems or anything else on a go forward basis that we'll have to defend you against? So those are kind of the mixed bag of what I look for.
I would agree with those. And I appreciate the approach we take. Operations gets involved incredibly early in the due diligence process, both in review of financials naturally, but also getting into the practices, meeting the providers, meeting the team members. I think a red flag for me is when the provider is not open to that, right? And is not being as open with their team. I've been on the side many, many moons ago of an acquisition, and I I remember being on the other side of the fence and natural concern from some of the team members at that time. And I think just that transparency to a certain degree at the right time and having operations in to see what impact we can make for the provider, the team members, and the patients overall is really important. So that would be an area that could be a green or a red flag easily.
Yeah. Willingness to have the same level of transparency that you're going to expect post acquisition. And Todd, I love that you mentioned patient satisfaction as well as the chart audits. And I have to say, I've asked this question of a lot of folks, and you're the first that's ever said the deferred maintenance of a practice could be a potential red flag. And oftentimes, like, quality of care is not one of the first things that's brought up. I think people lean into like, well, what are the production numbers? What's the output by provider? What's the makeup of the staff? What type of specialties are they doing? So really cool to hear like other ways of approaching understanding like how strong of a practice it ultimately will be post integration. And now talking about the post integration piece, Alayna, you mentioned the playbook that you put in place. There's the 60 days. What are some of the key things that are like integral to ensuring that an integration with a new practice goes smoothly?
I think what was mentioned before, definitely that early presence from operations, HR, and our internal development team is really important. Just boots on the ground to show people that we're people and it's not big fat corporate, right?
Yeah.
So I think presence is key. And then some of the more tactical items are software conversion. Again, we lead with data, so it's important that we can easily absorb data from the practice and track things that we may even see early on that could use some improvement, but then we can track improvement when we're implementing changes there. So software conversion, so we have data visibility is a huge one. And another is, Todd mentioned earlier, one of our core values is to have fun and to engage. And so we have found with acquisition that maybe that's not a core value or it was, but it's kind of faded. And so I think that's something that is not as common, but we do try to integrate, whether it's our Harmony Heroes or just on-site lunches to get feedback from the staff and the team during that integration process is really important. Naturally, I mean, the list, right? Vendor conversion, transition, all of those things are important and have to happen within those 60 days to be success to us. But some of the other components I think are just as important because it helps that new team that we don't know yet to build rapport with us, build trust with us, and really set a good foundation for working together in partnership.
Payroll.
Oh, also payroll.
Payroll.
That's like day one.
Day one. You got to make sure you get your the new team members. If you're taking over the entire back office functions, payroll is the most important because if they don't get paid on time or they get paid inaccurately, you start off on a bad foot. So I've always said the minute we do it, is the payroll right before the first paycheck run. Right. That's key in my opinion.
That definitely.
Absolutely. What are some of the quick wins that like a practice could expect to experience where they can see the benefit of being part of the Chord organization?
Taking the pressure off, right? I mean, I think, giving them the tools to do what they need to do. Alayna and her team, I mean, I think we have some of the best operators in the industry personally, starting with the top, but very clearly sharing a standardized approach to doing the functional items that need to be done, right? So every day the front office at the practices will come in and they'll know exactly what they need to do and why they need to do it. It takes so much pressure off the staff. Like, to a point, when we do an acquisition, I'm there in week 2. I want to meet everybody and I want to say, hey, how's it going? And then I'm back again in week 6. How's it going now? And you can see this sort of like wasn't as bad as we thought it was going to be. The team's been great. The staff is happy. That's the end game you're looking for. And I think, again, they're coming in and saying, if you do it this way, it will make your life easier. And that's a quick win.
Yeah. It's eliminating guesswork. That's what someone shared with me in our most recent acquisition, because my team, the operations team, but also my team, the internal development team that kind of houses integrations, will go in hand in hand and tackle anything that is outstanding, make sure that people can log into their HRIS to ensure everything's right for their payroll, or on-site, expanded training on software conversions, and eliminating the guesswork for us is we're SOP heavy, and we're training heavy because we don't want there to be a question mark if there is a process that's easy to follow. So that's been that's some feedback that I got directly from a team member in our last acquisition, is that I just don't feel like I have to guess anymore what I need to do. I have it in front of me. And that's a really good feeling because
absolutely
it releases that pressure, right? To Todd's point.
Or the doctor goes at 5 o'clock.
Oh yeah.
Right. Like that's a win. Like we did an acquisition and we heard from the owner. He's like, I haven't been home at 5 o'clock and I can't tell you how long. I'm like, that's the whole beauty of the whole system.
So look, neither of you are any strangers to dental. We've talked a little bit about some of the headwinds that the industry faces, but what are some of the things, I think this is an industry that we all love. What are some of the things that still make you bullish about the industry, the space, and kind of optimistic for the future?
Oh, there's several things that make me bullish about the space. One, dentistry is always needed, right? It's not going away. It's not a function that's going to be replaced by AI. Total replacement by AI if you read all the news, right? So I love that. We treat all pediatrics and predominantly in the government insurance space. And so I actually like coming to work because I know that we're providing a much needed service in much needed areas. We talk about what we do when we do our site visits and we go around to our practices. And I've been doing this for a long time. I like to sit in the waiting room and gin up conversations with the patients that are in the waiting room because you learn a lot about what's going on. So I think that's, to me, the need will always be there, which is why I like the industry. I think the need will constantly be something that people are seeking out, especially as they try to ensure that their kids have great oral health. We all know that oral health is the gateway to all health. And therefore, it's kind of like the front line of healthcare, in my opinion.
Yeah, absolutely.
I agree with that. I get excited about an industry that is always evolving. And I think about, 2026 for us, some of the things that we're implementing into our practices, whether it's new process or procedure at the clinical level that help patients. That's what makes me excited, is that it's always changing in a good way. And I've seen it over the last 15 years evolve to what it is today, and that continued evolution and providing access to patients that need it and parents that truly appreciate what we're able to do for their children. That's what keeps me coming here every day.
Last question. I was just thinking about this when we were talking about provider recruitment or doctor recruitment, and you mentioned it wasn't as difficult on the doctor side as it has been in hygiene and some of the other roles. But as a pediatric organization, when you're recruiting, and I don't know if you recruit a lot directly out of school, is it something where folks know, and this might be a stupid question, I'm asking anyways, do people know that they want to work with children? And is there any way to validate that they're a good fit and that that's going to be something that they end up enjoying?
I'd say pediatric dentists, orthodontists, they know that they've chosen that path outside of regular, just general dentistry, because they do want to work with the younger population. And I think the other big component to that is kind of how we do recruiting. We always do site visits. We ensure that our chief clinical officer is meeting with the candidate or his downstream team, or spending time with the candidate, they have kind of an automatic mentor as they step into the organization, should they need or desire it. So I think that's one way that, we know for sure that they want to be treating children, but I think verifying that we're a good fit for each other, we've got a good process in place for that.
Yeah, we run, and along with everything else that we do, we also run 2 pediatric dental residency programs in the country.
Oh, very cool.
For different universities or hospital systems. And so when you talk to the folks that are in their second and third year of residency, they'll tell you they knew immediately they wanted to work with children. That is what they wanted to do that. They have a passion for it. So, if somebody goes through the process of getting their dental degree and then going to a residency program, they're pretty well suited for pediatrics. And you can tell they love interacting with the children, which is so important.
Yeah.
We're lucky to house those 2 residency programs. And I think that's been such a benefit to me, something that I haven't experienced in past DSOs, but having that as a part of Chord has been wonderful, because we're able to support them regardless of their path. Of course, we'd love if they, would love to come work with Chord, or they plan to stay in any of the areas that we have locations. But just getting to see their progress and their growth through the time that they're in the residency program has been really, really, really beneficial to understanding the business in a totally different way.
That's very cool. I was not aware of that. Last question for you both. Where do you all go to learn? How do you stay up to speed with, your career growth, career progression, industry? What's your approach to kind of being a lifelong learner?
I do a lot of reading. I used to do all the conferences and all the events, and I would go make the circuit on an annual basis. And, I don't do that as much as I used to. There's some value to it. Of course, there's a couple of in the US. I actually like the smaller ones instead of the bigger ones that have just gotten too big.
Yeah.
But I like to read, right? If it comes across my desk, I'll read it. If it comes in my email, I'll typically read it. I'll pick up the latest book on executive management just to see if I'm missing something. So that's usually my approach to continual learning.
Yeah, I'd echo that. I'm also a big reader. I've never met an HBR book that I didn't like. But I think the other component for me is just conversation, being able to talk with like-minded people in the dental industry, also in outside industries that share some similarities. That's been huge for me to learn from people that have done this for a long time. I'm lucky to have Todd as one of those individuals, but just being open to having conversation and seeing what's working for others. I think there's space for everyone in the dental industry. And so if we can help each other get better through those conversations, that's always a good thing.
Yeah, I'd agree with that.
Awesome. Alayna and Todd, thank you so much for joining. Really, really appreciated learning more about Chord, and appreciate you all taking the time.
Yeah.
Thanks, Mike. Appreciate it as well.
Thanks for having us.
You're welcome. The Dental Economist Show is brought to you by Planet DDS. To find out more about how cloud-based dental software by Planet DDS helps unleash dentists and their staff to focus on patient care, visit www.planetdds.com. Stay tuned for upcoming episodes by following wherever you listen to podcasts. Thanks for listening.